And welcome to Let's Talk with John Kane and Regan DeLoggins. Again, welcome to the program. We are continue to Skype in as far as Regan and I go to Reggie, who is in studio. Obviously, we're going to talk about COVID-19 and what's happening from a little bit of a native perspective. It's interesting, and Regan, I want to thank you once again for for making the effort to be a part of this program, even under these trying circumstances. So, Regan, it's funny, you and I talked about our concerns over the racism associated with medicine a few weeks ago, and now it's all the talk.
I mean, it's not new to us, but I guess it's new to other people. So I'm glad that the conversation's being had, even though it's clearly at the expense of Black and brown bodies.
Well, and the part that concerns me is it seems like there's still something really, really missing in the conversation. When we brought it up before there was really any numbers to associate with with trying to really put data together on this thing. But we brought it up as our concern over already existing data over things like the mortality rate of mothers giving birth and those kinds of things, which even that, there was never any real good explanation on why that is. And so when I hear even, Tony Fauci there, suggesting, well, Black people have a higher rate of underlying conditions. For one thing, I'm troubled by that excuse or explanation for a couple of reasons, not the least of which is, even if it's true, then we're not addressing why that is. I mean, so why is it that people of color have a higher incidence of all these ailments and underlying conditions in the first place? I've also heard, Andrew Cuomo talking about this and talked about the
great equalizer.
Yeah, the higher level of people of color who are working in these low income essential services, like drive-throughs and clerks and that kind of stuff. And look, and I get that too, but they're still not addressing, is there systemic racism in the healthcare system, not just in health, but in healthcare. And I think that's what was being demonstrated by the mortality rate with mothers as far as giving birth. But that's not even being addressed at this point. Nobody is accepting any responsibility for the fact that there may be bias when a person of color, and I say more than may, but that there's bias when a person of color even attempts to receive healthcare.
So I think that I've been reading this book that I highly recommend to everyone, which is called Medical Bondage. It's written by a historian out of Queens College, a Black woman. And the reason I bring this up is because it talks about the history of the creation of the Gynecological Association and how it was so inherently tied to non-consensual testing on Black women, specifically the enslaved folks.
Mm-hmm.
And I think that's incredibly important to talk about because this is a historical issue. Specifically when it comes to Black women, they have not only been guinea pigs to the medical association, but that racism has existed within the medical field even before there was a medical field.
Well, and you can go back historically. I mean, even into Europe, the people who were being experimented on, live and otherwise, have always been a marginalized people. But and you mentioned it when we talked about it the last time. Let's not forget what took place in Alabama with the bad blood venereal disease studies that were done right up to the Nixon administration, I might add. The Tuskegee experiments and that kind of stuff. I mean, Native people, what they endured in terms of failure to quarantine things like tuberculosis and of course the mass sterilizations and things like that. The victims of some of this medical racism runs pretty deep in American history. It's just not widely talked about.
Yeah, and we need to be we need to be specific about medical racism, specifically right now with COVID, that it is disproportionately affecting Black folks and brown people as well. But right now, the statistics that are coming out are related to Black people, and this is not a coincidence. You know, Black people are less likely to have access to health care, less likely to have access to cars, and therefore rely on public transportation, are less likely to have a job. You know, they're more likely to have jobs within what is referred to as essential. So in food, like grocery stores, restaurants, delivery, even as nurses within the medical field. So we have these people who are most targeted by systemic racism, and therefore the least protected and the most vulnerable because of systemic racism. If people don't,
and they don't have the luxury of working from home. They don't have the luxury of working from home. They don't have the luxury of taking voluntary layoffs and not lose a dime in terms of income. A lot of times you were talking about people who may have to work, several part-time jobs just to come up with a full-time wage. I mean, which is never a living wage. So there's a lot of that plays into the whole thing. But you also mentioned, and I think it's worth noting, in a country like the United States that has no universal health care, the people who are on the bottom of the economic scales are the ones who suffer the most when it comes to receiving health care. And again, it almost seems crazy to have to say it, but health insurance is not health care. So Obamacare, all of that stuff, that's not health care. Those are financial products. Those are financial products that either are sold, in the free market, or they're imposed upon people as it was with Obamacare. So, yeah, that's not the same thing as healthcare. Healthcare is, Medicare is healthcare. Provides funds healthcare. But again, I think this is the stuff that gets lost in a lot of the equation. Now, the other thing that I've talked about for a couple of weeks has been the fact that these numbers that we're hearing, and look, and I can admit, I obsess over some of these numbers. I'm on these websites all day long looking at some of these numbers. But these numbers still are not accurate. And the reason they're not accurate, not because they're false or because the numbers themselves are being, altered or anything else, but in the United States, only less than 0.7% of the population has been tested. So all of the numbers that we're talking about, new cases, deaths, all of these, all these numbers are only for people who have been tested, and less than 0.7% of the U.S. population has been tested. Even in New York, it's only about 2% of the population, and that's the place on the U.S. map that has had the most testing. It's still only 2% of the population. Again, the overwhelming majority of the United States is way less than that, and in fact, again, it's less than 1% of the population. In places like California, and it's funny, the top 11 states in terms of number of cases, 3 of them are among the lowest rates of testing. California, Georgia, and Texas are among the lowest rates of testing. So how do we, make these judgments about apexes, and how do we make these judgments about? I mean, when Fauci says, "Well, it's looking like we're going to see a total death number of about 60,000 as opposed to 100,000." Sure, as long as you only are going to count the deaths of people who were tested when they're alive, because they aren't going back and testing dead folks. And that was another thing that I talked about in previous shows. And now it's come to light that there may be as many as 200 people a day dying at home in New York City alone.
Yeah.
200 people a day. And those numbers don't go to the totals because those people are not being tested. They aren't testing dead people.
And again, as we said specifically earlier, this is going to be a disproportionate amount of deaths that are brown and Black folks.
Which is exactly where I was going with this. Yeah. So when you talk about the people who are dying at home, those are going to be people who are going to have much more of an aversion to going to the hospital because they're they're both concerned about getting treatment, period, or whether they have certainly any kind of health insurance or anything like that. So. And those numbers haven't even come out yet. So they finally started throwing numbers out there that suggest, and this came out of New York City, a city councilman on the health committee, saying that there's between 180, 195, maybe 200 people a day dying in New York City. And I guarantee, like you're suggesting, that if you look at the racial breakdown of those folks, it's not going to be pretty either.
I also don't think it's a coincidence that New York has yet to put out racial statistics related to deaths from coronavirus. It's one of the few states with the highest amount of mortality rate to put out racial statistics.
And yet Andrew Cuomo goes on television yesterday saying, and he look, I'll give credit to those guys who are at least willing to talk about it. But when I hear Andrew Cuomo talking about it, says, well, New York isn't as bad as, say, Michigan, or New York isn't as bad as Louisiana, or New York isn't as bad. Wait a minute. How do you even know? You guys aren't even using the same measuring metrics. I mean, so you're absolutely right. I mean, when you look at these numbers, you realize it's kind of like voting in the United States. Every state is doing things differently. The numbers come in different, and of course, then when you try to extrapolate those numbers and you expand it over the global pandemic, you also realize that you're not sure what to believe. I mean, the fast movers internationally right now are Russia and India. They're slow. They're moving up the list as far as in number of cases, not so much number of deaths, which again doesn't quite jive with me. But so when I look at all these numbers, you got to take everything with a certain grain of salt, and you have to realize that at best these numbers are relative to the numbers the day before, but they aren't necessarily relative to the overall reality as far as spread and that kind of thing. Like I said, right today, the United States surpassed Spain in the number of deaths. There are a couple of days away from surpassing Italy, which would not only put the United States at confirmed cases only by testing, 3 times higher than any other country on the planet, but surpassing number of deaths and that kind of stuff. But again, these numbers are pitifully inaccurate because they are not taking into account the fact that the United States lags behind most countries, many, especially most of the so-called developed countries, in terms of the percentage of people, percentage of the population that is being tested. Trump will brag, "Oh, there's plenty of testing out there." Hell, he's shutting down some of the federal testing in the next couple of days. So that's going to make the numbers look better, but it's not going to be a true indicator of the spread of this thing or a true indication of the amount of deaths, because again, only those people who have been tested when they were alive are going to be characterized as death by COVID.
Yeah, and I think that if folks are looking to get some more some accurate numbers, I highly recommend the Al Jazeera website. They have a really, really great record of what is going on with COVID within the United States, and they have a map that has the number of reported corona cases in each state, and it's updated daily by Johns Hopkins University. And so you can see from state to state, from hour to hour, honestly, the number of reported cases. And to me, it's incredibly interesting to see that Georgia, as of right now, only has 6,383 reported cases. New York only has 118,000 reported cases. But we know that those numbers are not accurate, considering that most of the cases have not been reported. And as you said, when people do pass, it's not like they're testing them to see if they died to things related to COVID, unless they were in the hospital because of COVID.
Well, and that's the interesting thing. And I've said this before. I would love to see one of these sites that would do some sort of overlay of data or graph or something like that would show an overall number of or rate of deaths in a specific region, like in the United States or by state. Because if you see that there's a spike or an anomaly in the death rates, I would suspect that's going to be higher than just whatever they're attributing to COVID-19, especially when you consider that with all of this home confinement stuff that people are doing, there are less accidents, workplace accidents. There are less driving accidents. There's a whole lot of there's a lot less injuries and hospitalization or fatal accidents happening because of of all the stay-at-home orders. So any spike in the death rate, not just, and I'm not talking about COVID, I'm just saying in general, you've got to, if it's an anomaly over a normal time, say this, April of last year or month to month, you've got to attribute that anomaly to the one significant event that's causing death. And that's going to probably be a more accurate reflection, because it doesn't require testing. I mean, it just, other than testing for a pulse, I mean, it doesn't require the all of the other scrutiny that requires labeling something as a COVID death.
Yeah, absolutely. I also think it's important. I'm pulling up the article right now that the Times put out, which was, let me make sure I get the right date because I hate giving people the wrong information. So it was updated on April 9th. Earlier today. And what I think is really important is that, specifically talking about New York, because I'm in New York City, you are usually here with me in New York. And I think it's important to note that the studies that have come out thus far from the CDC and from Johns Hopkins show that the New York-based outbreak originated from Europe rather than from China. And so the incredible amount of racism and acts of hatred, and a number of people have been attacked here in New York City. A number of people who are Asian have been attacked here in New York City. And in fact, it came from Europe.
Right.
Which is a surprise to natives. We know.
Yeah, there's a history there.
Yeah, we know not to trust diseases that come from New York. But I think it's important because not only are we talking about racism systemically within the health industry, as I will refer to it, but also that racism exists within the.
Did I lose you? I just think I lost something here.
Quite terrifying.
All right. I'm sorry, I lost audio. I don't know what happened there for a little bit. So, but anyway, I may have lost the audio. Hopefully, the WBAI listeners didn't lose it. So,
all I said was that this is racism, and that the pandemic is showing us that systemic racism. This is not the great equalizer, as Cuomo said, but rather what Dr. Jones said on the Democracy Now! News show that came on before us, that this is all about resource disparity, resource segregation, and racism.
Yeah, and anytime I hear that great equalizer comment, I know you threw it out there earlier, but no, I mean, when people suggest, well, these things, they don't know borders, they don't know this, they don't know that. Look, any disaster that happens invariably is always going to have a larger impact on the most marginalized people of society, and there's really no question about that. So, when I hear people talk about the great equalizer, that's usually coming from a white person, because that comes from that comment comes from a position of privilege to even suggest it. Sure.
It's incredible. I think that, even if you look at the numbers right now, a lot of people are talking about Louisiana, and I think it's important to focus on Louisiana being a southern state. And 32.2% of Louisiana's population is Black, and 70% of the deaths related to COVID are Black people. Like, that is not.
Yeah.
You can make that.
Well, and again, when I hear these so-called professionals trying to rationalize that, and again, there's a line between cause, excuses, and explanations. Put it that way. And so when I hear some of this rationalization, I mean, I will say at least what Cuomo said yesterday was, they need to find out why this. But again, this isn't even just about, like you were saying earlier, this isn't about COVID-19. This is about the disparity that exists in the United States. I mean, even if you're going to make this generalization that black people have more underlying conditions, well, then why the hell is that? Are you going to suggest that that's not related to centuries of slavery? And and when I hear, and I also saw some ass post, well, black people have been living off of living off the government and in terms of food and housing, for all of again forever or something like that. I'm thinking, well, are you attributing this back to when white men tried to take ownership of black people and provided the meager subsistence that they had so they can get free labor out of them? I mean, it is bizarre when I hear some of the racist diatribe that still comes out. And look, it's great that a few people can suggest that everybody can feel all warm and fuzzy because we're going through this great equalizer of a pandemic, and that we're all in this together, and that we can all sing kumbaya as we're struggling, as a family of man. But you know what? And we've talked about this on the show. The racism persists, and it shows its head on not even ever so slightly, but it shows its head all the time on this thing. And that's why I find it very, very frustrating when you look at, I mean, whether you're talking about the stimulus package that has a incredibly disproportionate amount of financial aid going to the wealthiest people in the country, or any of this. I mean, it is really, really pathetic.
It's also important that we tie it back to history so that people understand that this is not a new thing. In the early 1800s, both Thomas Jefferson and Dr. Sims, who are considered the quote unquote fathers of, well, this was late 1700s for Thomas Jefferson, but early 1800s for Dr. Sims, they're considered the fathers of the current medical industry. And it's important to know that both of them published articles stating that Black people could endure pain at a higher level than white people, which is obviously incorrect. We see that in today's conversation, people of color, when they go into a hospital, are in fact not seen or dehumanized and seen like, oh, well, we don't have to provide them with accurate or proper medical health care because they can handle this.
Well, and Thomas Jefferson, I mean, there's recent information that came out in the last year that talked about how detailed he was in creating, essentially for the time, spreadsheets that would show how he could most efficiently feed and clothe and provide services to his slaves, figuring out that sweet spot where you get the most labor out of them and provide the fewest resources to them. I mean, that was Thomas Jefferson's one of his claims. He was, they said he was a little OCD when it came to really tweaking the numbers and providing a full accounting on how to get to maximize the labor and minimize the expense to slaves. And of course, that includes things like healthcare.
Yeah, and I really, really want to advocate for folks to read this book, Medical Bondage, by Deidre Cooper Owens. She did, this is in relation specifically to the American Gynecological Association and how American gynecology is based on non-consensual testing on Black enslaved women. But it also outlines the entire history of our racist health system and how Black folks are disproportionately targeted within our system because of race, gender, and systemic race and systemic issues that have been around since the birth of the Medical American Association, since the birth of the occupied United States.
Ironically, not a lot of people know this, but the film that I've shown several times at the Commons, The Doctrine of Discovery, the film is produced by Sheldon Wolfchild. Sheldon Wolfchild is actually related to when they refer to 38 and they say 38 plus 2, the plus 2 are two other Native people who were hanged separately from the original Dakota 38. Those two that were hanged, their bodies were stolen and whisked off to Philadelphia, and the last place that they can attribute where their bones, where their bodies had been whisked away to, talk about grave robbing, right, was the Thomas Jefferson Hospital.
Yeah, the history of medicine in the United States, throughout the globe, but specifically in the occupied United States, is one of racism. It is nothing other than using people of color, usually women of color, as guinea pigs to test venereal diseases, to test surgery methodologies, to test vaccinations. And even now we see that Black Americans are being used again as guinea pigs for a vaccination on COVID-19. Like, this is not new, but I'm glad that these conversations are being had so that white folks can understand and see that history is repeating itself.
Well, and you mentioned, this analysis that both Jefferson and Sims had come up with, that somehow Black people could endure more pain, because that is directly attributed by many in the medical profession as to why the mortality rate for women during childbirth is so high for Black women. It's because they think that they're somehow mischaracterizing the level of pain that they're having. And so it becomes dismissed. And I don't know how that translates. And this is what we raised as a concern several weeks ago, when you talk about something like this, where you have this massive amount of people who are seeking medical attention, who gets dismissed. I mean, it's fine to say, well, we don't have any policies of preference on who gets seen and who gets tested. I'll tell you right now, bringing it home here, I don't know anybody on the Cattaraugus territory of the Seneca Nation that's been tested for COVID-19. And I know some people who've been sick, but I don't know a single person here. And you know what? Ironically, and although I'll argue that the Cattaraugus territory of the Seneca Nation is not a part of Erie County, when Erie County puts up its map of where there are confirmed cases, the only place that shows up on the Erie County map as a place that has 0 confirmed cases is the Cattaraugus territory of the Seneca Nation. Now, I'd like to think that we have none. We have no cases. But I'm not sure that's even true. I just don't know. I mean, we've never been afforded the opportunity to take samples and submit testing samples for testing ourselves here. So we don't know if we're just being completely ignored in this process. So that gets down to some of the same issues that we're talking about.
Well, the indigenous nations, how they're defined by the U.S. government, are not included within CDC programming or organizations in any way, shape, or form. We're not included in their planning for natural disasters, diseases, or anything like that.
Right. And and that's a point worth taking, because although there is this thing called Indian Health Services, which is tremendously and incredibly underfunded compared to any place else, it's also worth noting that healthcare is not something that is a charitable it's not just a social welfare net. The obligation that the United States has when it comes to things like medical care is it's a treaty obligation. It is something that was negotiated, oftentimes in these lopsided negotiations. These were promises made in exchange for the cession of land. So, because anytime I hear something, and in that one nut job that we talked about last week, who went on to say how Native people are getting some sort of disproportionate, benefits out of the stimulus package. I mean, it couldn't be farther from the truth. So, and again, I realize most of what we're addressing here is some of the real disturbing data that's coming out, especially related to Black people. But a lot of this stuff that goes right across the lines as far as people of color. Hey, we're at the bottom of the hour. Why don't we take a break here? I do want to talk a little bit, because there's something really disturbing and morbid about how this so-called presidential election is going to proceed, and I want to talk about that a little bit as well. I'm not saying we're done with this one, but I also want to talk about that. So perhaps we'll do that when we come back. All right, thanks for coming back. This is John Kane with Regan DeLoggins. We got Reggie Johnson at the board, who's going to help us when we take calls at the top of the hour. look, there's just so much to talk about as it relates to what we're experiencing with this global pandemic. But again, a couple of things come to mind. And look, I got a comment here. So somebody who suggested, who was it, Regan? Regan who said, or no, Reggie who suggested
Reggie.
that this shouldn't be called the Chinese coronavirus. It should be called the European one, since that's what that's where it came this way, right?
I'm going to refer to it as that from now on.
All right, there we go. All right. Look, I also did a show. I don't know. I think it was while I was still in New York, Reggie, if I'm not mistaken, where I talked about this dystopian future is now. And that was before this. I was talking about how bizarre it is that you have world leaders that are at the highest level of incompetence we've ever seen and all. But now you mix a global pandemic, the level of death that is occurring because of this thing, and then you've got the most moronic people sitting in positions of power, including the moron who just got out of ICU in London. I mean, this guy just, had all the information that he just disregarded, and then ends up sick enough that they had to give him oxygen in an ICU. I mean, look, I know people hate it when somebody says, well, somebody deserves to have this or deserves to have that. I'm sorry. When I look at some of the morons that exist in positions of power, where you're talking about Bolsonaro, this woman down, trying to, who was a part of the coup against Evo Morales in Bolivia, Juan Guaido in Venezuela. What's the name of the jerk who lives in 1600 Pennsylvania Ave. That guy. It is incredible. I mean, the more authoritarian they are, the more this thing just boosts their ego, as if it's to say that somehow it just proves their superiority as a human being. I mean, it's incredible that we're living in this time right now where these things have merged, this idea of nationalism and racism and all this stuff, at a time when something like this comes upon all of us. But it also leads me to kind of one of the things that I know people are afraid to actually come out and say it, but there is a morbid nature about the way this presidential campaign in the United States is going to go forward. Because let's be honest, if there's one thing that's going to topple the Trump presidency,
John,
yeah,
you all that you said during the past 60 seconds wasn't on air.
All right. Yeah, I don't know. This Skype is letting us down quite a bit here. I know I've missed a little bit of what you guys have been saying too. Again, all I can say is that we've got a real problem in the world when, in the midst of this global pandemic, we have some of the highest levels of incompetence in these positions of power. But it leads me to something that really concerns me about what's going to transpire between now and November. Look, Sanders dropping out was something that was going to happen regardless, but I can't help believe, and I know people are gonna cringe because they're not gonna want to admit this. I gotta think that there are people within the Democratic Party establishment who are almost giddy with the failure of the Trump administration in the handling of this crisis, and which means they're giddy with the death totals, all of that stuff. So there's a certain, when people talk about the sacrifice for the economy, I got to think, well, that might be something coming from the right, from the left. I got to think that there's a unspoken sentiment amongst some of the people, and I hate to even say the left, but within the Democratic establishment that says, there's a sacrifice that people are making to unseat this president. So that's really, really disturbing. And I know that going forward, the everything else has failed from the Democratic Party standpoint in terms of trying to diminish Trump's popularity. So whether you're talking about impeachment or some of the his misogynistic statements, his racist statements, all of this this profiteering that that he's been involved in. the only issue that may stick going forward through to November is going to be this this thing. So I gotta think that there's almost a twisted jubilation amongst the Democratic Party establishment associated with Trump's failure in this crisis. So I don't know what your thoughts are on that. I may be alone on this thought, but I find it really disturbing.
Well, I also think that if anyone is interested, there's a great article that CNN put up on April 7th in relation to Wisconsin still holding its primary elections in the middle of this pandemic. And for me, this was a great example of the failure of quote unquote democracy, in which you have people, some wearing masks, some not. There's a great amount of pictures, some wearing masks, some not wearing any security, any sort of like mask or glove or anything at all, and all going to the polls in order to vote in a primary during a pandemic when we are told to not go outside. I think also in relation to the fact that folks also applied for absentee ballots, and those won't be counted or mailed out in time to be considered in the accumulation of the count for the primary.
Yeah,
this is an absurd. I'm not a Democrat and I'm not a Republican, but the fact that the Democratic Party is so eager to put people in harm's way in order to maintain the status quo blows my mind.
Well, and again, I mean, when I look at the tone that was taken back in 2016, about voting blue no matter what, or whatever their phrase is, they got a slogan I think that they're using now. But the idea of holding your nose and casting a vote and all that other stuff, the lesser of two evils, all that stuff. I just don't get it. I mean, if there was ever a place that somebody should have boycotted an election, it should have been Wisconsin last week, for crying out loud. But yeah. But there's a certain gullibility, and maybe if it goes beyond gullibility, it's maybe it's almost desperation that people have to believe that their vote really matters in this thing. I mean, let's be clear. Biden is not a real solid left choice.
He's a racist.
From Trump. There's two. I mean, he just talked the other day about how gracious his conversation was with, how wonderful it was to talk to Donald Trump just a couple of days ago. Ugh. I mean, look, I'm sorry. This guy is laced with misogyny and racism. Everything from, how he dealt, he characterized stop and frisk and the crime bill and so many. I mean, his gaffes are oftentimes associated with, his own Freudian slips. What was the one where he said the one day where he said something about, geez, I want to something like poor people are just as bright as white people.
Oh yeah, something like that. And I was like, oh.
You're talking about Biden, right?
Yeah, Biden. Yeah,
Biden.
Yeah. I mean, so, but this is gonna, again, it frames this whole election going through and how whatever's going to transpire over the next several months leading up to November as cloaked in a certain I don't know, a certain wish for more calamity on the left, and on the right you're going to have Trump continuing to say what a wonderful job he's done. I mean, so the whole thing is just bizarre. I mean, let's be clear. The United States, like I said, has 3 times more cases of this disease than any other country in the world. Any other country. They are now second in terms of total deaths, compared to any other country, and they're going to overtake Italy within a couple of days. So they will have the highest mortality rate, the highest positive test result rate. And the reality is, just like they were saying on this Worldometer commentary, it's probably only 1/10. Whatever is reported and confirmed probably only represents 1% of the, or 1 in 10, 10% of the full scope of the problem. So right now, with the United States claiming that they have 450,000 cases, it's probably 4.5 million cases. And just that they've only tested less than 0.7%. So
I definitely think
crazy.
that I definitely think that the presidential race moving forward will use COVID as a crux to pushing forward both parties. You know, the Republican Party will say that Trump did everything perfectly, and the Democratic Party will say that he did everything imperfectly, and therefore we must replace him with the neoliberal, capitalist, racist that is Biden. And then the Democratic Party will, rally folks to continue to vote blue in hopes to take down the Republicans. It's going to be the same thing that we've seen, with the Hillary campaigns.
What's that, Reggie?
Vote blue, no matter who.
Oh, that's what it is. Yeah, I knew there was some catchy slogan they came up with.
It's just it's also so problematic, that folks are in any way pressured to participate in the settler colonial politics that is the presidential election. You are not obligated to, and you should not.
Well, and as Native people, I mean, I saw somebody post something about Mark Charles just today, and I said, look, I wouldn't care if Sitting Bull himself was running for president. I wouldn't vote for him, because to me, it's an absolute sellout. Look, I got a meme that I put out there, a number of years ago. Actually, it was a comment that somebody turned into a meme, and it basically said the final chapter of a successful genocide is when an oppressed people fight in the armies of their oppressors only to oppress other people, and they stand in lines to vote for the agents of their oppression. And then somebody made a meme out of that, And I'm sorry, I can't attribute, or define assimilation any more accurately than wearing the uniform of the U.S. military or standing in line to vote for the next successor in your agents of oppression.
And, Reggie and I had spoken about this previously, in which we said that Bernie was our, what was the terminology that we used, Reggie?
Bernie was the compromise.
Yeah, he was our compromise. And now that he is no longer within this election, though you can still write him on the ballot, I wasn't planning on it anyway, but I'm definitely not going to vote. And I'm not going to vote for Biden. I don't have to, and I'm not obligated to participate in a system that is looking to maintain the norm, when the norm is systematic oppression, crappy healthcare, capitalism, imperialism. It is not my job. And I know that people might call in and say it is our duty. It is not my duty to clean up the mess that settlers created when they instilled, quote unquote, democracy on indigenous people.
Yeah, their version of democracy. Well, the other thing I think that is important to note is, again, the amount of pressure that's going to come on people to say that if you don't vote, that's a vote for Donald Trump. Well, here's what I've got to say about that. If 4 years of Trump could only enable the Democratic National Committee to produce Biden as an answer to that, then, maybe the United States needs 4 more years of Trump so they can finally make a proper adjustment when it comes to, how far left or how far progressive or whatever the word you want to use is. I mean, certainly the Democratic Party doesn't represent, progressive, any kind of real progressive values, especially if you've got somebody like Hillary Clinton or Joe Biden at its helm. And the reality is, the only thing at this point, Joe Biden is not going to unseat Donald Trump. COVID-19 might. And, and so it's going to be interesting to see how this plays out. But I got to tell you, it is disturbing. In my lifetime, I've watched, I can remember elections that have transpired. And every time you think it can't get any worse, it's just manages to get worse. And so, and like I said, I find it really disturbing that that the death and the larger the death count is, the more this is going to become the election issue, the issue that determines the next election. It's crazy.
And let's say Biden wins, which, come on, but let's say Biden wins, all right? Is that going to end deportations of undocumented people? No. Is that going to end the unjust bombing of Syria, Lebanon, Afghanistan, Iran, Iraq? No. Is that going to end The U.S. consistently supporting the settler state that is Israel? No. Is it going to end systematic racism? No. Is it going to provide us with health care for everyone, like actual health care? No. Like, these aren't changes. It is the status quo that is the bipartisan settler colonial politics.
I mean, just look at the reaction that Wall Street took the moment that that Sanders threw the towel in. I mean, they know that that Biden is good for Wall Street. Biden is good for the for the 1%, and there's no question about that. And so again, this is the whole that neoliberal label that is, if it's barely left of center, and you would think, rather than countering a swing to the right, that Trump did only out of pragmatism, not because he really believes in anything, you would think that the left would swing harder to the left, but they don't. They stay even more middle of the road, or if anything, and I've said this before, the right wins no matter what, because if you get a right-leaning Democrat, then you moved everything to the right, no matter what. So, I mean, that's what's disturbing about this thing. You didn't, counter Trump with progressive ideas, and so again, I'm not going to vote anyway. I mean, as much as I would have rather seen Sanders have success here than Biden. I wasn't going to vote for him anyway. It's just not what I do. I've said it before. I'm not an American. I don't vote in American elections. It's not my dog and not my dog fight.
So, John.
Yes.
You're saying that Biden, you don't believe that Biden is more electable?
Then what? Yeah, electability. You got to like that. Well, I mean, it depends on what you're voting for him for. I guess if it's putting a squeeze on women from behind, I guess he wins that race. I guess. I don't know.
Ooh, this is going to get some listeners angry now.
Well, let's face it. Trump grabs from the front, Biden grabs from the back. But that's what you got, right?
I'm going to point out that the two of y'all are making jokes on that is going to take effect on women and femmes.
No, look, I realize that.
Wait, John, let me finish. Though in a joking manner, this is still at the behest and going to affect women and femmes in a negative way.
That's true.
Both of them are misogynists. We don't need to participate in that rhetoric.
No, and I understand what you're saying, but make no mistake about it. It concerns me the level of misogyny that both of these primary these leading candidates possess, and again, I'll apologize for making light of it, but this is where the absurdity comes in, when a large enough segment of the American population can look the other way on this stuff. I mean, look, maybe making light of it is not appropriate, but the fact of the matter is, if you don't point out the absurdity and the outrageousness of it in some manner, then it just continues to persist.
But also, making light of it is what makes it the norm.
That's true.
So participating in that kind of joking, boys' locker room crap is in fact what normalizes sexual assault, and why Biden and Trump both have campaigns as people who have perpetrated sexual assault. So let's participate in woke thinking, which includes not making light of sexual assault.
I agreed, and I'll further say that whether Biden names a woman vice president or not does not undo any of that behavior.
Absolutely. But I also want to remind folks, because we do have to do a news. We have a news brief at 3:55. So I do want to remind folks to call in at 212-209-2877 with your questions or your comments, so that John and I can continue to riff with Reggie, of course.
I'm just here, just direct. I'm just giving you phone calls, so I'm here.
All right. Hey, since we do have a few minutes before the news break here, I do want to remind people that WBAI is listener-supported radio, and it does count on your contributions. So I do encourage people, regardless of when we're in fund drive or when we're not in fund drive mode, to call 516-620-3602. Make a pledge of any size. Become a BAI buddy in the name of Let's Talk. You can go online. You can go to www.give2wbai.org. That's GIVE, the number 2, WBAI.org. And you can follow the prompts to, again, make a one-time donation, become a BAI buddy. You can even follow the prompts on how to do a text to donation. So support WBAI, support Let's Talk with John Kane and Regan DeLoggins. And, we'll take a break for a news break here. And then when we come back, we will go to your phone calls. Again, 212-209-2877. That's the number to call to participate in the conversations, not just the ones we've just had, but any conversation that you'd like to have on these subjects. So we'll do that. Reggie, what's it look like for the news break?
Okay, so it should be coming up real soon.
Okay.
In 1 minute.
Let you know when it's ready, but you can talk until it's ready.
All right, sounds good. One of the things that again, it's important that people understand, the numbers that are posted and all of the numbers that Fauci and Trump and Cuomo and Pence are talking about.
Okay, stand by. Okay, stand by. The news is coming.
All right, go ahead. All right, thanks for coming back. This is John Kane with Regan DeLoggins. We got Reggie running the board and actually helping us take the callers as they come in. But I do want to remind people, first off, the number to call in to join us is 212-209-2877. And the number to make a pledge to WBAI and Let's Talk with John Kane and Regan DeLoggins is 516-620-3602. Again, we do regard the work that we do here as an essential service, even though we're staying home to do it. With at least Reggie's not, but the rest, but Regan and I are.
I am considered essential. I mean, for some reason, pressing buttons and making sure media happens to mediate.
Yeah. Well, and I guess you're staying home too, because apparently you live at WBAI now.
Oh my God. Eddie, you are so
wow.
Yeah,
I have a cot in the back. It's no big deal.
The last time I saw you were there, and the next time I see you, you're going to be there. So as far as I'm concerned, you're always there.
At least I have good Indian food.
That's good.
Yeah.
Well, there you go. But look, I want to be clear here. One of the things that concerns me about all the numbers that are being rattled off by, at the federal level or at the state level is, again, because it's only based on a very small sampling of testing, because, again, in the United States, less than 0.7% have been tested. There is this more than just a suggestion that the numbers are artificially being kept low because we're only counting the numbers of confirmed cases. So, this like anything else becomes propagandized, and the numbers can be manipulated by the rate of testing, by who is tested, how sick people are when they're tested, the racial breakdown on who's being tested. All of those things can be massaged based on simply sticking a swab up somebody's nose. So I think it's really important that people realize that. So I wanted to say that before we go to the callers. But I do want to go to the callers. So Regan, unless there's something you want to add, we'll go ahead and start.
No, let's do it.
All right. Well, Reggie, go ahead. We'll put the first caller. Caller, why don't you tell us your name and where you're calling from, and we'll hear your comment.
Here we go. Caller, you're on the air. Hello?
Me?
That is you.
Hello?
Yes.
A couple things on the numbers, especially, and especially as far as the deaths. Gary Knoll has done extensive speaking on the numbers and how they're being manipulated. And one of the things that he said was all pneumonia deaths are now being attributed to COVID, and flu deaths are all being contributed to COVID.
No, they're not. No, they aren't. Unless they were tested. The only deaths that are attributed to COVID-19 are deaths that come from somebody who has been confirmed tested positive. So that's not true.
John, all due respect, Gary Knoll has done extensive looking into this, and his history as someone with a degree in public health science, 50 years in the health, and also 50 years as an investigative journalist. If he says that's so, I'm going to say that is so.
All right. Well, then you go ahead with that. But all I'm saying is that the only numbers that are being put out as confirmed cases are the ones who tested positive. I think there's a lot more people who are passing away to COVID-19 that are being attributed. So I don't know if Gary's trying to say the numbers are being inflated or deflated, but regardless, unless they aren't testing dead people. So and they're not trying to bump up the death rate number. So I don't know. I'm not exactly sure what is being suggested here, but regardless.
Also,
Okay, we have another caller ready.
Gary, no. I'm good. Let's go to the next caller. I'm good.
Okay. All right, caller, you're up next with John and Regan. Tell us your name and where you're calling from.
Hi, my name is Dennis. I'm calling from Brooklyn.
Hey, Dennis, thanks for joining the show.
I really appreciate you guys. Please keep beating them over the head with the facts. I want to talk about an elephant in the room that I think no one has mentioned. And I think that over the last several decades, we have seen a very dangerous union between the large organized religion and political parties. And I think it's gotten to the point where it has now reached separation of states.
I'm sorry, but I think I got the gist of what you're saying. Unfortunately, your phone reception is pretty poor, so it's kind of hard to hear. But again, what the caller was suggesting is that the increase in the influence over large religious organizations has come to the point where it's hard to make the case for a separation of church and state. And I think there's something to be said for that. So. And it isn't even just Christianity. I mean, the amount of influence that religion is playing on so much. I mean, frankly, even not only governmentally, but even socially, in terms of how you regard who you're going to hate next, has a direct relationship on not only what somebody's religious preference is, but how you regard somebody else's religious preference. So, I think there's something to be said for again how much influence religion is playing on on society, especially at a time when both Jake and I were laughing in the studio when we heard the news break, because when they said scientists disagree with Trump's claim that this disease will go away miraculously. Ooh, what a surprise! You mean science disagrees with miracles? So as I'm listening, even to this caller, you would think at a time where we should have more information, there is still this overwhelming sense, and maybe it's the same faith that people have in the democratic, or the quote-unquote democratic process, that lulls people to sleep. And I don't know if you have a thought on that as well, Regan.
Well, I think blind faith is problematic in all ways. Blind faith, not just through religion, but just blind faith in anything without questioning authority. Not even if you're not questioning the authority of where this is coming from, then like, what are you doing? I think that's my biggest thing with whether it's organized religion or whether it's
government.
Whether it's the government, no matter what it is, if you're not questioning the authority of where this information is coming from, then I find that you are most likely to be led astray. Critical
thinking. It is. Look, I don't know how you advance, not even as a society, just as a species, if you fail to react to the real and tangible things that are in front of you. And and I think that's what we're faced with. So again, thanks for that call, and I agree. I think religion is not just the 800-pound gorilla, but it's the 800-pound gorilla in the room that is a threat to a lot of people. But that again, I agree with you. All right, let's go to the next caller. Caller, you're up next. What's your name and where are you calling from?
Okay, that's you, caller.
Hi, I'm Joe. I'm calling from Hell's Kitchen, and I want to urge all three of you, John, Regan, Reggie, to vote on here tonight, because I want you to show up. You don't have to vote for the president. You could leave it blank. You could write in your ancestor's name. You could write in your best friend. You could just vote the down ballot, because even if you're able to avoid paying taxes and avoid paying sales taxes, you're constantly voting as a consumer in this society.
Then there you go. Because here's the president. Oh, you go ahead first, Regan. Go ahead.
Are you a person of color?
Against that, to show up and say, I believe in some kind of democratic process.
Are you a person of color?
And it says vote.
The caller, Regan is asking you a question.
Okay, go ahead, Regan.
Are you a person of color?
No.
Then don't tell me how to vote.
Or to vote.
You have all the privilege as a settler on occupied indigenous land, and you to come to three people of color and to tell us how to navigate the democratic process
imposed on people.
It's inherently racist.
Yeah.
I don't need to participate in a system that was subjugated upon me through genocide.
Well, and I want to go further than that, because and I've spoken to this a number of times. I don't live in New York City, for one thing. I live on native territory. And here's the problem that I have specifically.
It is native territory.
Well, I just want to hear me out on this thing. Specifically, the problem that I have is that if Native people who live within a Native community register to vote, I have to list my home address as a part of New York State. And I'm never going to do that. I'm simply not going to do that. And that's only one of the reasons not for voting. I mean, voting is the ultimate in assimilation when it comes to people who have been subjugated, as Regan suggested. So the idea that somebody says that I have to believe in this democratic process and I have to demonstrate it to others that I believe that's like trying to impose it, just like from the previous caller. That's like trying to impose a religion upon us. Look, if you feel strongly about that system, then go ahead and participate in it. But I'm going to tell you right now, the system is flawed, and it doesn't matter if you get more people to participate. It's flawed anyway. The Electoral College thing, the dominance of two political parties that have sway. I mean, I mentioned the other day on a post that the parties select the candidates, not the voters. And somebody said, "Oh no, the parties don't vote." But when you look at what happened, Sanders was leading this race on the Democratic side until every established Democratic Party notable went ahead and endorsed Biden. That's when the swing happened. This wasn't just something that was going to happen all by itself. When all the people who dropped out of the race and every significant Democratic personality endorsed Biden, they swayed the vote. So don't tell me that this was just about voters. And in between superdelegates, which is another sham, the idea that states that have almost no population compared to states like California and New York have the same amount of U.S. senators. The system is flawed, and if you think that I should participate in that because you support it, I got to tell you, I agree with Regan that it is somewhat of a racist demand. I mean, because I don't know. And look, I understand where your heart is at, and you would and by all means, you should encourage everybody in your family to think like you. Just don't try to encourage me to.
Also, I disagree with that completely, in the sense that we have an obligation to radicalize the people that are listening to the people that are not listening. We have nothing but time right now because of COVID-19. It is our duty as people to radicalize one another against the settler state. And participating in voting is not my way to radicalize.
I agree with that. I'm just saying, look, people can do whatever they want to do, but calling into the show and suggesting that Reggie, Regan, and I need to vote in this process and participate in this process it's pretty arrogant as far as I'm concerned. Yeah. All right, let's go to another caller. Reggie, pull somebody else up, would you?
Okay, caller, you're on the air with Regan and John. Tell us your name and where you're calling from.
Hi, George from Jersey. Guys, nice show.
Hey, George.
I just want to talk about Bernie real quick. It was his only move. It was his only best move. He realizes, like John just said, that the whole thing is rigged. He was going to the DNC with pride in the head. He had to wake up the people. He has to save us. He genuinely wants to save the people from this corona, whatever. He actually has to go to work for that because all the dust is on the other side. So he's going to look like the hero that he is, fighting for everybody in America. The Americans going to wake up and they see two female crazy molesters on the state stage. And if we do not see the need for Medicare, corporations out of our elections, and our elections are rigged, our system the loser, the whole pyramid scheme must be exited.
Look, I'm sorry. I just can't make out much of what's being said here. The reception, the phone reception is terrible. But I will, again, I got the gist of what the caller was, what George was talking about. Look, I don't disagree with Bernie's candidacy, his campaign, or him dropping out of the race. I heard a lot of people condemn him and calling Bernie out for dropping out. But look. Knowing what's going on right now, I think the whole election system is a sham anyway, but it becomes even more. Like, I agree with Regan. This should be more of a time that people reflect on just how corrupt and how bad the system is. I mean, again, what took place in Wisconsin last week is a perfect example of that. I mean, you can't help but wonder, because the only really race was a Democratic primary, and the fact that it was being imposed upon the public. I mean, was this intentional to try to, I don't know, disable a whole bunch of Democratic voters? I mean, it's really, really twisted. So, look, I think, I thought Bernie Sanders represented, at least like Regan and Reggie suggested, a better compromise within a system that is really, really terrible.
Yeah, he was the only compromise, really, and he was the most progressive and therefore the most threatening. Absolutely.
All right, let's and look, I got to apologize. Skype isn't doing as well for us, even between Regan and I connecting to WBAI, and I know we're having a little bit of difficulty with some of the callers. So again, apologize for the quality of some of the audio. We're doing the best we can, and I guess we'll take the good audio weeks with the bad audio weeks. So all right, so Reggie, go ahead and pull up another caller if you would.
Okay, caller, you're up next with Regan and John. Tell us your name and where you're calling from.
Hi, it's Russell up in Westchester.
Hey, Russell, thanks for joining the show, and you sound great.
I'm fine. I had this about a month ago, and I've got over it. But I'd like to let Regan know that laughing at sexual assault jokes affects straight white men in a negative way, too. So I'd like to remind her of that. I think you guys need to look into the concept of false consciousness. John, do you know what false consciousness is? Have you heard of that?
I haven't heard it as an expression, but go ahead.
What it is, in short, that I understand, is that it's a way of using ideology and ideals to get the working class to do things against their interests. It's like saying, oh, the deficit's a bad thing, so we have to get rid of the deficit. That's a bad thing. So when we have false consciousness that tells us, oh, we have to stay away from each other, treat each other like we're diseased, that is making the working class collapse. Going along with it is a bad idea. And one thing I'd like to remind you is that when the media shows thousands of Jews congregating at weddings and funerals, and then they arrest Jewish leaders 4 months after Christmas, when the anti-Semites have been beaten on individual Jews, you think that's going to affect anti-Semitism? I mean, they're not going to wait till Christmas to beat on Jews. And I feel bad about blacks. You know why blacks are more affected? Because they go to the hospital because they know if they don't go to work, they better get a note that says they have this. That's why they're more exposed. Everybody's getting it at the hospital.
Wait, I'm confused. Russell, wait, I just want to rewind first. Wait, what were you saying about my comment related to sexual assault?
Well, Regan, what I heard you say is that laughing at sexual jokes affects, I believe you said women, femmes, but I didn't know. You gave a list of things, but I didn't hear straight white men in there, because straight white men are negatively affected by guys who laugh at locker room humor, too. Okay?
Okay, I just don't consider straight white men as people who are the most affected by sexual assault.
And when you talk about Biden, you don't include sexism in the litany against Biden. So I think if you want to prove how woke you are, maybe you just got to check yourself.
I'm sorry, when I don't talk about what? I'm sorry, can you say that again?
You sit there, you talk about Biden, and you list racism. He's pro-corporate, but I don't
misogynism.
The sexist assaulter. He assaults women. You don't mention that in your litany against Biden.
I said misogyny, which is the hatred against women.
Yeah, I think we did list that as far as one of the problems with Biden.
But I want to know, like, also, what is the difference for you in me referring to misogyny versus referring to sexism?
Okay, you're picking his. John, one thing, please.
No, I'm asking you for clarification.
It's because I caught you on something. Listen, you don't think white men are... Caller, Regan is asking you a question.
My name is Russell, not caller.
Okay, Russell.
Right.
Russell, I am asking you, and I'm not asking in a way to put you down. I'm asking for clarification. When I refer to misogyny as hatred against women, how does that not relate to sexism?
Misogyny is hatred against men and women. You understand?
That's not what misogyny is.
It's hatred against blacks and whites, okay? Racism against blacks affects white people negatively too.
How?
Okay? Well, how old you are, young lady?
First of all, don't talk to me like that. I'm not a lady. You asked me to call you Russell, I'll call you Russell. You call me Regan. And I'm here to listen to you and have a conversation with you, and you're being demeaning.
All right, I want to interject here. We can be done with here. I'm not even sure. I don't know if Russell is trying to call down almost everything that we've talked about here, which is fine for him to have that opinion here. But he's mischaracterized things that I've said. He's mischaracterized things that Regan has said. He's also suggesting that what do you call this thing? What do you call this consciousness? What was this thing that he said?
He called it false consciousness.
And so apparently he thinks the social distancing thing is a way to control us, I guess. I mean, and I didn't even get the whole Jewish thing. So I missed the whole point of his thing. And rather than going back through the whole thing, I'd rather just move on with the conversation. I'm not sure that I agreed with anything that Russell said, but I have to admit that I didn't quite understand much of what Russell said either.
I also want, if Russell, you're still listening, I don't know what you were referring to in relation to anti-Semitism, but I would also like to remind you that not only am I a Native person, but I am Jewish. So if you want to talk about anti-Semitism, like, let's do it in a way that is respectful and not you calling me lady and being super rude.
Well, and I also think it's problematic when a white person calls in and starts talking about how white people are adversely affected by racism towards or sexism towards or misogyny towards women or racism towards towards people of color. Look, there may be a negative consequence of racism against the perpetrators or the group that is responsible for racism, but it pales by comparison. So I just have a difficult time with all that.
White cisgendered men have never had to deal with racism. They have never had to deal with sexism. They have never had to deal with prejudice. And anyone who thinks differently does not understand what racial systemic issues are. And on that point, let's take the next call.
Go ahead, let's do it.
Great segue, Regan. You're on the air with Regan and John. Tell us your name and where you're calling from.
Hi there. First of all, thank you for taking my call. I'm Elle from Long Island, and I want to say that you guys, terrific show.
Thanks. Thanks, Elle, for joining us again. I'm always glad to hear from you.
We may not agree on every point, but the thing is to respect what we say and to try to understand our differences, because it could be a learning point for us.
Sure.
So, that said, I'd like to say, keep in mind, 2046, the population of this country is to become predominantly people of color. And it is noticeable that the Spanish flu didn't start in Spain or wherever. So we have at least I would suggest for us to study, learn, share different things that are occurring now that are basically geared towards containing us in a position, eliminating us from the position totally for the goal of someone else. Now, in regards to Biden and Sanders, listen, on you are so on okay with that. And I want to say that we should keep in mind that war, I think, was he 206 when he had a chance of challenging but did not challenge. And the excuse, or shall I say the reason that was given was doing it for the betterment
That was correct,
of
El.
the country.
That's correct.
I beg your pardon?
I say you're right. You're right on that.
Okay, so now the bottom line is this. What Sanders did, he has disappointed a lot of people because he was my opinion, the last beam of hope. There are many people who are going to say, well, listen, rigged, it's corrupt, and hey, look, come on. And I will say this in closing. Keep in mind, Donald Trump didn't get to the position because he earned it, given. And it prepared for him through the efforts of many, from Bush to Obama. Oh, yes. And keep in mind, what has, at least I have to hear Obama praise anyone or support anyone. All right? But Biden hangs on to him, hangs on to him, hangs on to him.
El, I want to thank you for that. Regan, I'm hoping you're hearing El a little bit better than I am. There was a lot of cutting up, but I did catch a lot of that, and especially the whole riding the coattails of Obama that Biden's trying to do. Biden's trying to do. But by all means, I'll let you weigh in on El's comments because I think I missed some of them.
You know, honestly, I also couldn't hear El very well, but and maybe did Reggie, or I'm just going to throw it to Reggie. Reggie, did you hear?
Yeah, somebody had to hear something, right?
Pretty much El was saying is that she agreed with everything that was said so far. And basically Biden pretty much is riding on the coattails of Obama and his association with Obama for 8 years and had yet to bring up any kind of policy that would be positive, that would be proactive during this time.
Well, and let's on that, and I think Elle suggested her disappointment in Obama as well, yes, and I think if you really talk to anybody who is prominent in any of the black communities, most would agree that there's a fairly high level of disappointment in how much Obama did in terms of him being an equalizer when it comes to some. I mean, didn't Mitch McConnell once suggest that black people don't need reparations because they had Obama, and he certainly was anything but.
I also think it's important to note that Biden isn't going to be creative and come up with new things because his entire intention is just to bring back to things how they were and maintain the status quo. So he's not going to be throwing out important or progressive ideas like Bernie did because it would ruffle feathers, and his intention is to just get in there and keep things as placid as possible rather than in any way shaking it up. So honestly, the difference between Trump and Biden is one is less orange than the other.
I want to bring up something else too, just to kind of take a walk back on history. I know this is going to date me some, but can I remind people that after the debacle that was the Richard Nixon, his second term, Carter won the next election and was a one-term president. I mean, he was in and back out immediately. The Republicans took solid control a mere 4 years after the debacle that was Richard Nixon. And My concern is that even if Biden does manage to beat Trump in this election, that because there wasn't any type of, as Regan was suggesting, new ideas or new movement that would demonstrate a better path for the United States, that it would be just as likely that Biden would be this era's Jimmy Carter.
I think that I'm interested to see what happens, but this is assuming that Biden wins.
Well, yeah, I'm not assuming that, but I'm saying if it happens. All right.
Right.
Let's go to one more caller before we take a break here. But do we got one lined up there, Reggie?
Yes, we do.
All right.
Okay.
And again, I apologize that we seem to be having more difficulty hearing on the phone than normal, but this is kind of what we got to work with. So let's try to do it. Go ahead.
Okay, caller, you're up next with John and Regan. Tell us your name and where you're calling from.
Hey, how you doing? Charlie here, Roslyn Heights. That caller two callers ago, I loved what he said. I think he was basically saying, I couldn't hear him too well, but I think he was basically saying that white men are scapegoated because of identity politics in this country, and identity politics has ruined American progressivism.
All right, Charlie, give it one more shot, because I know you say the same thing every time you call in. But realize that you hate racism because white people are victims of racism and identity politics. And I know what else. Capitalism solved slavery and feudalism. So go ahead. What else you got? What else you got?
Yeah. Okay. Now before I make my point, I want to send my condolences to anybody in the BAI community that lost anybody. And if anybody's fighting that virus right now, we are with you. We are bigger. Humanity is bigger than this virus. Okay, hang in there. But the point I wanted to make is there's a 2,000-pound elephant in the middle of the room that nobody's talking about. Dr. Fauci was saying that if you have diabetes or if you have hypertension, you're more likely to die from this terrible virus. Okay? How do you get those diseases? How do you get diabetes and hypertension? By personal choices, by diet and stuff.
All right. Okay. Let's be clear. Poverty contributes in a huge way to the limited choices that people have in terms of what they eat, how they eat, the lifestyles that they get to live. So when I hear people try to suggest that people are responsible for their own illnesses just purely out of personal choice, that again is coming from a solid position of white privilege. And on that note, I don't know if you want something to add to that, Regan, but we'll take a break here at the bottom of the hour if not. But go ahead.
I was just going to say that I feel that Charlie and Russell should hang out.
Yeah, they should.
That's it.
What makes you think? Oh.
All right, we'll take a break and come back. Yeah, we're getting some good callers here, man. Not good people, but good callers. So we'll pick it up when we come back after the break. This is John Kane with Regan DeLoggins and Reggie in the wings. We'll take a break and be right back. All right, thanks for coming back. I gotta laugh because we're texting back and forth during the break, and Regan, you've been introduced to Charlie in a big way for a couple of weeks.
It's fine. It is what it is.
No, and look, this is the kind of stuff that people, especially people of color, are deal with and face all the time. But this whole idea that white people want to appropriate misery amongst themselves because they want to demonstrate just how victimized that they are. I mean, even going back to Elle's comment, the problem that I have relates to Elle's comment and the comment before that talked about the rise of religion. Even if the majority, whenever that date is when people of color become the majority, if it's so divided along religious lines, and it still appears to be very much a lot of that, it's tough because you're never going to have a majority of people who can be like-minded enough to affect positive change. It's one of the problems with this idea of democracy. It sometimes just puts weight on the largest loudest group of people. And and one thing that it is clearly demonstrated especially in the battles between, say, Republicans and Democrats, is that Republicans are louder and they have more of a mob mentality, and that's why they have a disproportionate amount of control over the political systems. And a lot of times that is runs along religious lines as well. So I just want to throw that out there. I don't know if you had any other comment you wanted to add before we go to another caller, Regan.
All I got to say is that I'm laughing to keep from crying. Let's take the next caller, though.
All right, Reg, go ahead and pull up another caller.
All right. So, caller, you're on the air with Regan and John. Tell us your name and where you're calling from.
Good afternoon. Bonita calling from Central Harlem.
Hey, Bonita. Thanks for calling in again.
Thank you for having me. And I'm laughing to keep from crying also, Regan.
Good. I'm glad. Not alone.
And happy holidays. Hello.
Thank you, Shaq, for having me too.
I wanted to mention briefly about being healthy and Black people. And so I know the cause I'm hearing is because of finances. And I just wanted to mention that it didn't have to be because of finances. It's a mindset, because I always ask if the doctor is giving you some information, your BMI number, so you pay attention to that. No, I see with my own eyes information flown across the table, and I just want to live my life the way I want to live it, and that's it. And so, because the information is getting out to the masses, but they don't want to digest that information, so it's their choice. So it can be less to have local vegetables, because there's farmers markets all over this city, and plug into that. But you have to want that and desire that. So.
Well, I appreciate that comment. But here's the thing I do want to say. Just like we can have people be successful by various measures of success from a depressed or an oppressed people, we do see perseverance in that. And I think that people can make healthy choices regardless of their economic standing or their ethnicity and that kind of stuff. But if you have to understand that racism and income disparity does impact all this stuff, and while there are people and it's possible to persevere and make intelligent healthy choices about your lifestyle, there is a certain conditioning that happens because look, coming out of the slave era, just because slavery ended in name didn't mean that Jim Crow didn't exist for several generations. Just
and
because excuse me?
As well as sharecropping. Sharecropping was used to replace slavery, but in fact, it was just slavery.
Yeah, the biggest challenge that white people had after coming out of the slave era was, how do you get all those black people back to work? And how do you get them back to work for some nominal salary as opposed to just slave conditions, which oftentimes weren't much of an improvement? So, go ahead.
Often, what was done instead was that you were people of color were given a piece of land, quote unquote, from a plantation with the expectation to continue to work it without pay because your payment was that land.
Well, and then to get into from a Native perspective, there is no question that when you took a people who were hunters and gatherers and people who farmed in the way that we farmed, and then you strip away land, you remove them from the environment that they had grown accustomed to for thousands of years, and then you deliver them vats of lard and rancid meat and wormy flour and all this other stuff, and so you completely change a diet from something that was healthy and sustainable to something that was a recipe for hardening arteries and diabetes and that kind of stuff. not everybody has those healthy choices. There are food deserts. There are medical deserts. There are all of these things that exist for people who have been oppressed. And in spite of the best efforts of a few individuals who may show some resiliency, it's hard for the overall population of these oppressed groups to demonstrate in a large way success, successful navigation of these inherent racist conditions that have been imposed upon them.
And I think that it's also important to note that, so if you have EBT or SNAP or food stamps within New York City, you get to use them at farmers markets, and you get a 2-for-1 deal in which your dollar is actually doubled if you buy at farmers markets. But farmers markets rarely stay open past 4 or 5, and therefore working people of color who don't necessarily work a 9-to-5 or may work a 9-to-5 don't have access to these farmers markets in which they may be able to get fresh, organic food. So I think that's also something to navigate. And consider the price of groceries. Fresh fruit is more expensive than a box of Kraft mac and cheese. So there, huge discrepancy in nutrition versus, like caloric intake. You want to be full, especially if you're on a poverty line. You want to feed your children. You want to be full versus I want to provide my kids with the most nutritious meal, which will in fact be more expensive.
Sure. And I think that's, you can't undermine the desire of any parent to satisfy the hunger of their children, and those times, oftentimes, there's a compromise that has to be made for that. So I appreciate exactly what you said, Regan. Go ahead, Reggie. Go ahead, and we'll pull up another caller.
All right. Next caller, you're up with John and Regan. Tell us your name and where you're calling from.
Hi, John and Regan. I'm Paul in Brooklyn.
Hey, Paul. Thanks for calling in.
My pleasure, really is. When I hear Russell and the previous, the two aligned people,
Charlie.
When I hear them, I think that this whole process that we're in right now, and especially Bernie being kicked out, because he was basically kicked out.
Yeah.
Basically, it's about a power sharing paradigm. And the people who have the power refuse to share it with the people. So they're not going to let the people have the power. And that's why Bernie being kicked out should not stop the people who agree and want to follow a Bernie paradigm to continue to rally for that. Because that's what was going on. That's why they wanted to stop it so quick.
Yeah.
Now, John, another guy who was talking about, I'm feeling oppressed and scapegoated because I'm a white male. You can always opt out of your white maleness. Opt out of my black maleness. I can't opt out of the inability of my black maleness to go into the marketplace and achieve the same things that white males can achieve.
Absolutely.
I can't opt out of that. So you have the right. You could see me a block away, but you can't see a homosexual white male a block away. You have to get up there close and talk to him before you even get a sense that he might be homosexual. But you don't mind him being homosexual if he's white. You might mind him being homosexual if he's black, because you can see blackness a mile away. So their privilege is something they can opt out of, but when they do opt out of it, that means they join the minorities and the oppressed populations and have to be standing side by side with them as they're being oppressed in their standing. So you can't get the people who have been oppressed in order to claim that you're scapegoated.
Well, and I want to address it because you bring up a good point about power sharing, because it is even the question of them wanting to share their power. They want to appropriate whatever they think offers any kind of consideration to somebody else. So whether it's stealing on somebody, appropriating somebody else's misery, or claiming to be victims of racism, even when you're white. I mean, all of this stuff. When I hear some of this stuff, and this isn't to say that white people don't ever have challenges. White privilege doesn't mean that you are living as a wealthy person. It means that your race was never a contributing factor to that. That's what white privilege is. And I think it's important that people understand that. But when I hear a Charlie or a Russell talked about being victimized as white people, look, you may be victimized for maybe because of your crazy ideology, but you're not being victimized because you're white. That's one thing that's clear.
Yeah, your race doesn't participate in it. People of color, we cannot escape what we look like, and therefore cannot escape prejudice, discrimination, segregation, distaste, dislike, distrust. We can't escape that. White people have the ability to navigate a world in which their skin color literally makes no impact on the choices made.
And even to the extent that these assimilation programs have tried to assimilate, people of color, that is still problematic, because not only is there a limitation to how much we will ever assimilate into white society, but the fact that that's what the request is absurd. The idea that we should opt out of who we are from an identity standpoint and try to merge. I mean, that's the whole idea of trying to merge with the dominant society. I mean, there are people who have suggested that unless the oppressed people merge with the dominant society, which is almost impossible except for through intergenerational marriages and that kind of stuff, or childbearing, I mean, that means that you have to cease to exist as a people. So while that may not seem like murder or ethnic cleansing, it absolutely is genocide to suggest that you have to cease to exist as a distinct people to fit in with the dominant culture. So I just want to throw that out there.
I do want to make a point that the queer community has been oppressed, and there has been laws made against the queer community, and that, though it may not be an overt thing seen in the same way that race can be, viewed from a quote unquote a block away, it is still important to note that there is queer phobia, transphobia, homophobia, asexual phobia, intersex phobia that exists within the spectrum. And if you see me walking from a block away, not only can you tell I'm brown, but you definitely can tell I'm gay.
Well, I can't disagree with that.
John knows you well.
All right, let's see. I know we're running this clock down, so let's see if we can get a few more callers in before we run out of time here. Reggie, go ahead and pull another one up.
Okay, and with that said, Regan, I still love you regardless. I don't care. All right, with that thing. Okay, caller, you're on the air with John and Regan. Tell us your name and where you're calling from.
Yeah, hi, Reg. This is Arnold. Hi, John and Regan. This is Arnold.
Hey, Arnold. Thanks for calling in again.
Yeah. In regard to the COVID-19, I think this has been something that's been building for many, many years. I think back in the 60s, you had MK Ultra doing experiments. Like, for example, there was one in the New York City subway, I think about 1966. There was an experiment done there where actually the CIA experimented doing chemicals in a subway. I don't know all the whole details, but that's been well documented. So I think the origins of COVID-19, I think, goes back since the mid-60s. It may even go back further.
Well, I do want to make a distinction between doing tests and running, computer models and actually experimenting with the intentional release of viruses and that kind of stuff. I think there have been a lot of testing that has been done to see what would happen. But having said that, I want to be clear that regardless of where any of these pandemics start from, you are going to understand that the role of government and the role of military in particular is to develop multiple contingency plans on how they react to these things, not the least of which any of those contingencies are to utilize them in a way to promote an agenda. So while, there are diseases that may be naturally occurring, there's no question that there's a certain level of weaponizing a circumstance and using a circumstance to advance a political agenda, a geopolitical agenda, financial interests, all kinds of things, military power. There's all kinds of ways that these, even if they are, regardless of whether they're man-made or naturally occurring, there are ways because there are ways that governments and military and authoritarian leaders utilize these events to advance their agendas. And so I just want to put that out there.
I think it's also important to note that we as Indigenous people know all about the weaponization of disease. And we also need to pay attention that whether COVID, I know some people believe that COVID was introduced by different governments and some, like whatever your belief system may be on how COVID.
5G, what's the 5G thing? I don't even get that one. But okay.
I don't know. I guess my cell phone is giving me COVID. I don't know. Point is, I understand that there is fear mongering and we want to question authority. And no matter how COVID has come, it is here. And what we need to do is make sure that the government, the politicians and folks don't use COVID and weaponize it against us. For example, what we see is happening with the Democratic Party and what we will see moving forward with the presidential election, in which COVID will be the most important discussion and part of the debates. And that is not appropriate.
Well, and again, to make a finer point here, there are those out there who believe that because of this pandemic there are other privacy issues that should be compromised. There's always the talk about installing RFID chips in people and that kind of stuff. Whether that really is as big of a reality as some people want to inflate it to be. But even some of the vaccination issues, and I'm not necessarily trying to take an absolute anti-vaxxer position on this thing, but let's be honest. I mean, people don't vaccinate against the flu in as large a percentage as the medical industry would like them to do that. And I don't know that if a vaccine for COVID-19 is developed within the next year and a half, I honestly don't believe a large segment of the population or the majority of the population will sign up for those vaccines. So, and for a lot of good reasons. Some of those have to do with the skepticism that we talk about. All right, we probably have time for one more caller. I don't know if you want to add to that, yes. Regan.
Yes. The only thing I'd want to ask is I urge folks to watch the movie V for Vendetta. It's an older film. I say older because it came out when I was in middle school. It's not even that old, but it's just a fun thing to keep your mind guessing.
Alert.
And it's about the weaponization of disease in order to create authoritative governments.
Sure.
And it's a way to talk about anarchy as well, too. V for Vandella.
Yeah. All right, we got time for one more quick call, and hopefully we don't get cut off by the news, but we might. So go ahead, caller. Right. Last one.
All right. You're the last caller. You're with John and Regan. Tell us your name and where you're calling from.
Hey, how you doing? This is RD out of Brooklyn.
RD, how you doing?
I'm fine. How is y'all doing? John and Regan, did I get it correct?
You got it right.
All right. I just had a few things to throw out there. My mind is all over the place as I hear the people calling in. One I want to say, okay, this number that they're throwing out, I don't know if I'm the only one hearing it, but I've just been hearing statistic numbers of African-American people being plagued by this COVID-19. Why is it all of a sudden it's just now coming out when we've been dealing with this for almost, a month and a half now? And why is it only African-American numbers? If, quote-unquote, Trump said the disease spread it from China, correct me if I'm wrong, I haven't heard any numbers or cases coming out of the population of the people that dwell in this city from China, like in Chinatown or in Queens, and so my whole thing is, what is it going on? Is they racially putting the numbers on again the people that's oppressed more than the other quote unquote privileged population? And if you could expound on that a little for me. And I have one more other thing.
Well, we probably won't get to it because we're going to be cut off by the news here shortly. But the issue with the racial component here, and Regan and I brought this up a couple of weeks ago. Our concern is that there does seem we know that there's a disproportionate number of black people in particular who die at things like with childbirth and that kind of thing. Our concern was that this was going to play play out when we looked at the numbers associated with COVID-19. I think the part that's concerning is as numbers did start to come out, they started realizing that black people were dying at a disproportionately high rate compared to white people who experienced the same disease. And so the scramble has been, especially by again, the white power structure, is to try to offer some explanation, whether it has to do with underlying conditions or whether it has to do with their jobs and that kind of thing. But they never come right back to discuss the impact that racism plays on not only pre-existing conditions, but racism plays on the quality of life that people live.
Access to healthcare as well.
Exactly. That's when that fits in with that quality of life. So I don't think this is an attempt to deride black people. This is an attempt to shine a light the fact that black people are being are experiencing a disproportionate level of crisis because of this. Just like people of color experience on every natural disaster, whether it's a hurricane or whatever happens, it seems like poor people and people of color are disproportionately affected, and that's exactly what we're seeing as this thing plays out. And actually, New York is probably not as bad as some of the other cities supposedly, but we're going to see what the numbers look like when all's said and done.
Yeah, we urge folks to take a look. Like I said, I recommend people read Al Jazeera for some great updates related to the numbers that are coming out here.
All right. Hey, Regan, I want to thank you again for joining me this week or being a part of what we're doing here. Folks, tune us in next week, 3 o'clock on Thursdays, 3 to 5 every Thursday for Let's Talk with John Kane and Regan DeLoggins.